Basic medical sciences, welcome. In this video, we are going to talk about the skeleton of the lower limb, skeleton membri inferioris. We will talk about general classification of the bones of the lower limb, but we'll focus on the pelvis, right? So the bones of the lower limb can be divided into two main groups. Number one, bones of the pelvic girdle, ossa singuli membri inferioris, and the skeleton of the free lower limb, right? So bones of the pelvic girdle, the hip bone, right? Os coxae, also known as innominate bone. Skeleton of the free lower limb, right? So you have the following bones: the thigh bone or femur, here in red. The bones of the leg or crus, right? Thus are tibia and fibula. Tibia in yellow, fibula in green. Bones of the foot, right? Also known as pes, right? And these include the tarsals, right? Ossa tarsi, the metatarsals, ossa metatarsi, the bones of the toes, ossa digitorum pedis, right? And each toe will have three phalanges mainly, right? Phalanges digitorum pedis, right? It will be proximal, middle, and distal, right? That's in general. But the first one, the great toe, is called hallux. This one has only proximal phalanx and distal phalanx, right? So we will talk more about this second part in the next video, right? So if you feel like this video is helpful, please make sure you give it a thumbs up, and most importantly, don't forget to subscribe. Now let's get into the hip bone, right? So this is the hip bone. You can see it in three different colors. It means embryologically these are three separate bones: ilium, os ilium, the pubis or pubic bone, os pubis, and the ischium, os ischii, right? So these bones will fuse by synostosis to form one bone, os coxae, the hip bone, right? But you need to know that they are separate, right? So what you are seeing here, this one is the lateral view, right? And this is the medial view, right? So let's zoom into it and see like each independent bone one by one, right? But firstly, you need to know the functions of the hip bone. Of course, number one is movement, because it takes part in articulation with the sacrum and the femur, right? Sacrum will be sacroiliac joint, and the femur will be the hip joint. The next function, protection, and of course support, because like the support of the upper body will be transferred to the legs through this bone, right? This one is we can say it's like a bridge, right? Okay, so let's zoom in, right? So firstly, you can see the ilium here, right? So it is the ala and the body. This one is the body of the ilium, right? On the external or on the lateral surface, you see some important lines, right? This line you are seeing here, this one is called anterior gluteal line, and here you have posterior gluteal line, and here inferior gluteal line, right? Inside, like on the medial view, it forms a fossa. It's called the iliac fossa, right? Okay, that's all for now. I will show you some other features at the end, right? So we go to the second one, the pubis, right? It is a body of the pubis, right? And then it is like the superior ramus here and the inferior ramus here, right? Then the next one is the ischium. This one, right? You can see this ischium. The most important feature you will see here is the ischial tuberosity. That's number one, right? So when these three bones fuse here, they form firstly the acetabulum for articulation with the femur, and between the ischium and the pubis, there is this foramen. It's called obturator foramen. It's very important, right? So other features, here you find the anterior superior iliac spine, anterior inferior iliac spine, right? Superior and inferior, right? And then you see this iliac crest, right? It's called the iliac crest, and this one is the tubercle of the iliac crest. On the back, you find the posterior superior iliac spine, posterior inferior iliac spine, and between this posterior inferior iliac spine and the body of the ilium, you will see this notch, right? It's called greater sciatic notch. Inferior to the ischial spine, you see another notch. It's called lesser sciatic notch, right? They are very important. I will show you what they form later, right? So important features you need to note here are the gluteal lines, anterior, posterior, inferior, the iliac crest, the iliac fossa, the acetabulum, the ischial spine, the obturator foramen, pubic tubercle. Okay, I will show you the pubic tubercle later, right? But you can see it here, right? And the articular surface, right? So these two will make the pubic symphysis, right? So I will see other features as we dig deeper, right? So you can see this one is like anatomical position, right? So this one is the sacrum, and you can see the right and left hip bones. Okay, so you see this joint which I mentioned there, sacrum and ilium, is called the sacroiliac joint. Sacroiliac joint. You can see the iliac crest here, the ilium. This will form the iliac fossa. You can see the anterior superior iliac spine, the anterior inferior iliac spine. You can see the obturator foramen here, and between these two you can see the subpubic angle, right? Subpubic angle, it will be very important, and the acetabulum, right? About the pelvic inlet I will tell you later, just stay tuned, right? So for now you can see the pelvic inlet, right? So this is the pelvic inlet. It's formed by the promontory here, the margin of the ala, right? And then this line is called the arcuate line. The next one in blue is called the pecten pubis, and lastly in purple is called the pubic crest. This forms the what? The linear terminalis, or the inlet of the pelvic, right? The pelvic inlet. Okay, I will tell you more about this in the next slides, but here you can see the x-ray image, right? You can see the iliac crest, the ilium, the sacroiliac joint between the sacrum and the ilium, right? You can also appreciate here you can see the pubic symphysis, obturator foramen, the ischial spine is here, the anterior superior iliac spine is here. Other labeled features like greater trochanter, lesser trochanter, we'll talk more about them later in the next video. Right, so let's talk about the joints of the pelvic bones. So all types of joints which you will find in the pelvic bones reflect the successive developmental stages of the skeleton, right? So they start from the ligaments, the syndesmosis, synchondrosis, that's between separate parts of the iliac bone, right? Because firstly I said there will be cartilage, and then they will fuse by synostosis, right? So after the fusion to form the hip bone, that's synostosis, and then a hemiarthrosis. This one is the pubic symphysis, and then diarthrosis. This one is the true joint, the sacroiliac joint, right? Okay, so let's talk about the sacroiliac joint, articulatio sacroiliaca, right? So this joint is formed by the articular surfaces of the sacrum and the articular surfaces of the ilium, right? So you can see labeled here the sacroiliac joints, right? So these surfaces, the surfaces of the sacrum and ilium, are congruous, and they are covered by a thin layer of fibrous cartilage. What are the characteristics of the sacroiliac joint, right? Number one is the simple joint, articulatio simplex, because it's only formed by two articular surfaces. Number two, is the plane joint, articulatio plana. Why? Because the articular surfaces of this joint are flat and they contact closely and differ only slightly. The sacroiliac joint is the short, tightly stretched articular capsule and very strong and short reinforcing ligaments, which limits the movement of the sacroiliac joint, right? So this will, because of this limited movement, is called amphiarthrosis, right? What is amphiarthrosis? Again, the joint that permits only very slight gliding movements, and this reduces the jolts and shocks between the bones. Next, auxiliary ligaments of the sacroiliac joint, right? So there are four main ligaments, like we can say four groups, right? The first group, the interosseous sacroiliac ligaments, ligamenta sacroiliaca interossea, right? So these ligaments stretch in the form of short bundles between the iliac tuberosity and the sacrum. They are the strongest ligaments in the human body, the interosseous sacroiliac ligaments. Next, the anterior sacroiliac ligaments, ligamenta sacroiliaca ventralia, ventral, anterior, same thing. Strengthen the joint anteriorly and they are tightly fused with the joint capsule. Number 3, the third group, is the posterior sacroiliac ligaments, ligamenta sacroiliaca dorsalia, dorsal posterior, right? So these ones run down from the superior and inferior posterior iliac spine to the sacral vertebrae. The last group is actually the iliolumbar ligament, right? So this ligament stretches between the transverse process of the fifth lumbar vertebra and the iliac crest. Now I'm going to show you these ligaments, right? Starting with the anterior view, right? So I finished with the iliolumbar. You can see from the transverse process of the fifth lumbar, right? That's iliolumbar ligaments. Right here you see the anterior sacroiliac ligaments, right? So other ligaments, I did not mention them yet, right? So you can I'm going to show you the back side, right? The back side, you can see here the iliolumbar ligaments. Now you see the interosseous sacroiliac ligament here, right? And then the posterior sacroiliac ligaments, right? So we'll look at others in the next view. Right, so these are syndesmosis between the pelvic bones, right? So firstly here you can appreciate a ligament from the sacrum to the ischial spine. It's called the sacrospinous ligament, ligamenta sacrospinale, right? And the next one is this ligament from the sacrum to the ischial tuberosity. It's called the sacrotuberous ligament, ligamentum sacrotuberale, right? So if you see this crossing will form foramens, right? If you remember, this was a superior notch and this was an inferior sciatic notch, right? Superior sciatic notch and inferior sciatic notch. But because of these ligaments, now you have these two foramens. The greater sciatic foramen, foramen ischiadicum majus, that's major, and the lesser sciatic foramen, foramen ischiadicum minus, right? And then if you look here, you on the obturator foramen is covered by the membrane, obturator membrane, membrana obturatoria, except this one point you see a canal, right? It's called obturator canal, canalis obturatorius, right? This canal is very important for transmitting the obturator nerves and vessels. Next, we'll talk about the pubic symphysis. Is symphysis pubica is a hemiarthrosis, right? There is a small cavity inside, a very small cavity, right? So between the symphysial surfaces of these two hip bones, there is a fibrocartilaginous plate. It's called the interpubic disc. Latin name discus interpubicus, right? So it's lodged in between here, right? In between there is a slit-like cavity, right? It's seen in this disc near to the posterior surface. The pubic symphysis is strengthened by the following ligaments. Above, superiorly, by the superior pubic ligament here, superior pubic ligament, Latin name ligamentum pubicum superius, and below there is an arcuate ligament, ligamentum arcuatum pubis, which rounds off the subpubic angle, right, from the angulus subpubicus, right? But this ligament is also known as the inferior pubic ligament, right? Right, now let's just talk about the pelvis as a whole, right? So both hip bones unite with each other, as you have seen, together with the sacrum, to form a bone ring, the pelvis, which connects the trunk with the free lower limbs, and at the same time enclosing a cavity containing the viscera, right, the pelvic organs. So the bone ring is divided into two parts. There is a greater pelvis or false pelvis, right? That's pelvis major, which is the wider upper part, and the lesser pelvis. This one is called the true pelvis or pelvis minor, and its narrow part, which is below here in yellow. That's the lesser pelvis or true pelvis, and here in green around will be the greater or false pelvis, right? So this is another view where you can see the false pelvis here, greater pelvis, and lesser pelvis here, right? So the cavity of the greater pelvis or false pelvis is part of the abdominal cavity. Actually, it lies superior to the pelvic brim or the pelvic inlet, which I mentioned previously, but I'm going to tell you more about it again this time. The greater pelvis contains abdominal viscera, for example, the sigmoid colon. Walls of the greater pelvis, right? So it has three main walls. Lateral walls are formed by the iliac fossa of the right and left iliac bones. The anterior wall is formed by abdominal muscles, and the posterior wall is formed by the lumbar vertebrae. You can see here, right? So posteriorly there will be lumbar vertebrae. On the lateral side you see the right and left iliac fossa, and anteriorly you will find what? The anterior abdominal muscles, right? Then next is the pelvic inlet, which I promised you, right? So you've seen this before, right? So it's also called what? The linea terminalis, right? The pelvic inlet is formed by, from the back here, the promontory, right? And you see the margin of the ala, and next here there is the arcuate line, right? Linea arcuata ossis ilii. And the next, the pecten of the pubis, pecten ossis pubis, and last but not least, the superior border of the pubic symphysis, right? Symphysis pubica here, but here is labeled pubic crest. You can see. So that's the pelvic inlet into the true pelvis, right? So that's the greater pelvis. Now let's talk about the lesser pelvis, right? So starting with the walls, right? This one should be the walls of the lesser pelvis, is repetition, right? But the anterior wall of the pelvic cavity is very short. It's formed by number one, the pubic symphysis, the symphysis pubica, and the right and left pubic bones, ossa pubic dextra and sinistra. The posterior wall is long and is formed by the sacrum, os sacrum, and the coccyx, os coccygeus, and the lateral walls of the true pelvis are formed by areas of the hip bones corresponding to the acetabuli, that's the acetabulum, in plural acetabuli, and the ischial bones together with the ligaments reaching them from the sacrum. We talked about the pelvic brim or inlet. Now the outlet or the inferior aperture, right? The inferior aperture of the pelvis, apertura pelvis inferior or outlet, is formed by the rami of the pubic and ischial bones. Next, the ischial tuberosities with the sacrotuberous ligaments stretching from the sacrum to the ischial bones, and their coccyx. Right, so this image is showing you these important cavities, right? So here is the abdominal cavity. Here, the abdominal cavity. And in light green is lesser pelvis, right? You can see a portion of the lesser pelvis and the greater pelvis here. Okay, so there are differences between male and female pelvis, right? These are some of the differences, right? In general structure, the male pelvis is thick and heavy, for female is thin and light. The muscle attachment in male pelvis, the male muscle attachments are well marked, but in female they are poorly marked. Greater pelvis is deep in male and is shallow in female. The minor pelvis is narrow and deep in male, but is wide and shallow in female. Superior pelvic aperture is heart-shaped in males and oval or round in females. The inferior pelvic aperture is comparatively smaller when compared to the female one, because the female outlet is large. The subpubic angle is narrow in males and is wide in female. The obturator foramen is round in males and is oval in females. And lastly, the acetabulum is large in males and very small in female. Right, so these are the main differences between the male and female pelvis. If you want to know more about like distances, measurements of the pelvis, we'll do that in obstetrics, right? But for now, this is all you need to know in anatomy, right? So thank you so much. Thank you for your attention. Peace out.